Greetings, good morning, good afternoon, good evening, colleagues. You are very welcome to this socialprotection.org webinar, Investing More and Better in Universal Social Protection. We're very pleased that you could join us in this webinar, which is going to take place over the next hour and 15 minutes. We have a very distinguished panel, so let me just begin with a few very brief remarks, and then we will move to our panelists. First, let me just say that the topic of our webinar today is one that has particular salience in the current context of crisis that we're in. The COVID crisis, as we know, has made it very painfully clear that too many people in the world, basically had no social protection to fall back on when this crisis hit. In early 2020, our figures show that less than half of the global population was effectively covered by at least one social protection benefit, while basically what that means is that the remaining more than half of the population, about 53%, which counts as many as 4.1 billion people, were left entirely unprotected. Now, we know very well that the gaps that we have in coverage, gaps in adequacy and comprehensiveness of social protection systems is driven by many different factors. Extensive informality in the world of work, institutional weaknesses, lack of voice, and insufficient accountability on the part of states are all factors that drive this inability to enjoy the right to social security. But we also know that among the factors, there is also a significant underinvestment in social protection, particularly in Africa, in the Arab states region, as well as in Asia, which is also not surprising, given that the COVID crisis, hit the world at a moment when we had just been through almost a decade of fiscal austerity. To give you just a few figures, we know that on average, countries are spending about 13% of their GDP on social protection. This figure does not include what they spend on health. But we also know that behind this kind of global average, there are actually staggering levels of inequality. We know that high-income countries spend on average about 16.4% of their GDP on social protection, which is really a far cry from the 1.1% of GDP that low-income countries are able to spend. I think also looking behind these figures, we really also need to delve a little bit deeper into the root causes of the lack of realization of the right to social protection by examining the kind of macroeconomic policy choices that countries make, the fiscal policy choices that they make, and also the dominant considerations that guide the public budget. And this means really looking at tax policies, how they are set, and how budgetary choices are made. Now, in the International Labour Conference, when we had a recurrent discussion in June of 2021, our constituents were very clear by underlining the urgency of ensuring that adequate and sustainable financing is put in place through a combination of sources of financing. They referenced the importance of combining both contributory and non-contributory financing, with progressive and effective taxation systems playing an important role, as well as having effective allocation of resources, all of this being really indispensable elements to ensure that fiscal space is created. So countries are not, condemned to not having fiscal space. There can be fiscal space creation, and the constituents also highlighted the need to ensure the adequacy and sustainability of these nationally defined social protection systems based on very key principles of solidarity, of collective financing, of intergenerational fairness, and of gender equality in how resources are mobilized and how resources are allocated. So we really need to look at both sides of the equation. how resources are mobilized, how equitably this is done, and then, of course, how resources are allocated. Now, to shed more light on some of these important issues, what I'm going to do now is hand over to my two colleagues, Mira Beerbaum and Valerie Schmidt, who will have 10 minutes for presenting to us the papers that are really the principal opening for our discussion here today on the issue of financing of social protection. So without further ado, I want to hand over to Mira Beerbaum and to Valerie Schmidt. And can I please suggest that for all the introductions, colleagues, please refer to the bios that are available. And we decided that we're not going to spend too much time introducing people. So Mira Beerbaum from the ILO Social Protection Department, Social Protection Specialist, and Valerie Schmidt, who's the Deputy Director of the Social Protection Department at the ILO. Over to you, colleagues.
Thank you very much, Shara, and also thank you for already providing some key information that we are also planning to share now a bit. So I will start with talking briefly about the background and the context in which these papers have to be placed. And Fernanda, if you could kindly put the presentation there and there the second slide. So we know that social protection is a human right. It's enshrined in the Universal Declaration on Human Rights, as well as other major human rights instruments. And far beyond this, there is also a solid evidence base that documents the social and economic returns in social protection for individuals, for societies, and for economies. For example, in terms of contributing to better health and education outcomes, in terms of stabilizing economies during economic downturns, or also when it comes to contributing towards social cohesion and peace. And as Shara already mentioned, this has been illustrated also during the COVID-19 crisis, as a wave of government action has been put into place to mitigate the negative effects of COVID-19. And social protection has been a crucial frontline response to protect the health and the incomes of workers and their families. When we now move forward, social protection will be an integral part of the human-centered recovery. And it's also an important element of a structural transformation of economies, including the just transition. So as Shara also already said, we know that this is not a reality for all. So more than half of the global population has no access to social protection at all. And there we also see extensive differences across and within regions and countries, and also between different population groups. You can find more information, more analysis on this in our World Social Protection Report, which was published last September, and I will provide the link in the chat in a couple of minutes. On the next slide, as you will see, there are, of course, large and persistent protection gaps, which are linked to many barriers, and among this is insufficient public investment. So as mentioned, on average, countries spend approximately or invest 13% of their GDP in social protection. But once again, there are large disparities across and within regions and countries, and also for countries at different levels of development. And what this means then is that this insufficient public investment results in financing gaps to achieve the Sustainable Development Goal targets 1.3 and 3.8 on universal social protection and universal health coverage. So on the next slide, you can see the results of an ILO study that estimates the resources that would be needed to guarantee at least a basic level of social security to all. And in developing countries, this would be 1.2 trillion US dollars, which is equivalent to 3.8% of GDP. If you just look at the group of low-income countries, this amounts to $77.9 billion. But in relation to their economic capacity, this is nearly 16% of the on average of the GDP of these countries. And when you look, for instance, at countries in sub-Saharan Africa, this also means that they would, on average, have to triple their investment in social protection. Over to Valerie for the next slides.
Thank you, Mira. Good morning, good afternoon, colleagues. So, so to close these coverage gaps and to close the financing gaps that Mira has explained, countries will need to invest more in their national social protection systems, and additional investments should primarily come from domestic resources. And the good news that is shown on this slide is that there are many options, even in low-income countries, to mobilize more domestic resources for social protection. One of them is to increase tax revenues. This can be achieved by addressing tax evasion, by broadening the tax base and creating new taxes for social protection. Botswana and Zambia, for instance, have introduced taxes on their natural resources to finance social protection. However, and this is a very important point, new taxes should be progressive to further increase redistribution. Extending mandatory social security to workers and enterprises in the informal economy is also a strong option for generating domestic resources for social protection. The word mandatory is very important because we all know that voluntary affiliation usually results in low take-up rates and irregular contributions. And here, as an example, I would like to cite Algeria that has successfully extended coverage to self-employed workers. A third strategy is to reallocate resources within the state's budget and replace regressive allocations with progressive social protection investments. Indonesia, for instance, has managed to liberate resources for social protection through the removal of fossil fuel subsidies. Improving the governance of existing social protection institutions is also an efficient way to better use resources and therefore to liberate more resources for social protection. It also creates trust in the system and therefore compliance with the payment of social security contributions. But as we will see on the next slide, Fernanda, for low-income countries, the financing gap represents around, on average, 15.9% of their GDP. So for them, it will be very difficult to achieve the universal social protection by 2030 if they don't receive additional international financial assistance in addition to their domestic resource mobilization efforts. So the idea is that this assistance doesn't replace domestic resource mobilization efforts, but complements them. And in addition to complementing them, as you can see on this graph, it should also boost national capacities to generate domestic resources for social protection. So we will learn later in the panel discussion the interesting case of Kenya, that has managed to progressively increase its domestic resource mobilization capacities and being less reliant on international financial support. Today, more of official development assistance, or ODA, should be allocated to social protection. We know that social protection accounts only for less than 2% of total ODA, which is very low when you compare the importance of social protection and investments in social protection for the OECD DAC countries. Other initiatives such as the debt service suspension initiative that was agreed during the COVID-19 crisis by the finance minister, the G20, are a very useful way, of course, to free up scarce resources and that could be used during the crisis to provide, for instance, emergency responses, including in the area of social protection. And we have all heard that the IMF has announced a new allocation of $650 billion of special drawing rights that could be, to some extent, used maybe for social protection in the context of the recovery. But we also know that low-income countries will only receive a small share of this 650 billion, around 21 billion US dollars. So we really hope that advanced economies will rechannel surplus SDRs to vulnerable countries in need to support their recovery, including in the area of social protection. So what is clear is that the international community should create an environment that is more conducive to domestic resource mobilization in the future. So next slide. So from the examples on domestic resource mobilization and international financial support, it is clear that more coherence and consensus are needed to make more investment in social protection a priority. So at country level, a whole of government's approach is needed to ensure that, as Shara mentions, the policy priorities in the area of social protection also coincide with the financing priorities. Such consensus can be built, for instance, through assessment-based national dialogues that are explained in the papers, and integrated national financing framework processes that involve the different ministries, so finance, planning, labor, social affairs, health, etc., social security institutions, social partners, and civil society. So in Mozambique, where such national dialogues are taking place, national public resources for social assistance have steadily increased in the past 10 years, and the number of beneficiaries has more than doubled. Similarly, to the national level, greater coherence should also be achieved among international development and financial institutions that are providing advice to developing countries on social protection policy and on social protection financing. So consensus building and coherence, both at national level and among the international community, are key to achieve not only more, but also better investments that really reflect the views of all the stakeholders and therefore are also more sustainable. And here, what is interesting is that the social protection floors recommendation number 202 was adopted in 2012 by all ILO member states, provides a roadmap that can guide more and better investments in social protection. Over to you, Mira.
Your time is up, so please try and wrap up so we have time for the panel.
I will be very brief, Shara. So on the next slide, you can see these 19 guiding principles that are spelled out in recommendation number 202. And for you to understand these 19 principles, they are kind of the backbones of a universal, adequate, comprehensive, and sustainable national social protection system, and also a system that is adapted to developments in the world of work. And what is important is that these principles need to be implemented in a holistic manner, because if you fail to implement one of this, the whole architecture of the social protection system may fail. So what we do in this paper, or in the second paper, is that we look at these principles and we regroup them into 7 areas to elaborate a bit more what all of this means in practice. So to put it really like in less abstract terms and to show what this means and what kind of tools you have. So on the next slide, you will see how we kind of try to make this a little bit more tangible. When we talk about investing better in universal social protection, what we mean, first of all, is to acknowledge the primary and overall responsibility of the state. When it comes to building a vision, what is really central is to achieve a national consensus, which is based on effective tripartite social dialogue. And when building the systems, of course, you want to ensure that no one is left behind so that you can fully realize the right to social security. The principles also guide countries on how to make progressive and sustainable investments in social protection and how you can ensure social solidarity. And this social solidarity includes also solidarity in financing. Overall, there are always diverse approaches and mechanisms to achieve universal social protection in line with different national circumstances. And these principles really encourage countries to look for an optimal balance in the certain context that they have and to explore diverse approaches. And finally, it's key to ensure good governance and also to create synergies both within the social protection system, so when you use different schemes and programs, but also far beyond that. When you look, for instance, at employment policies, labor market, wage policies, but also policies that relate to care. So when you consistently apply all of these 19 principles in policy and financing decisions, it kind of automatically comes that all investment in social protection are systematically used to build universal social protection systems that also provide a social protection floor to all members for society. And back to Valérie for a very brief final word on this.
Thanks, Mira. So I think we go to the next slide, Fernanda. Yeah, thank you. So you may have heard about the Global Accelerator for Jobs and Social Protection that was launched at the end of September by the UN Secretary General Antonio Guterres. This accelerator aims to accelerate the achievement of the SDGs in the area of decent jobs and universal social protection. And it will support countries that we call Pathfinder countries that are really committed to investing more and better in jobs and social protection through integrated approaches, notably. So this is, as you see on the graph, the pillar 1. The accelerator will also promote and support additional investments in low and middle income countries through domestic resource mobilization, but also temporary or complementary international financial support. So this is pillar 2. And the third pillar is about involving a high ambition coalition of countries, the UN, development banks, the IMF, social partners, civil society, and the private sector to really create greater coherence among the different actors in the area of social protection. So this is pillar 3. So the ILO is responsible for coordinating the implementation of this global accelerator, notably through the establishment of a technical support facility that will support all pillars. And so what is interesting and why we talk about this global accelerator today a little bit, is because the ideas that are really contained in these 2 papers will be further promoted and materialized through the implementation of this global accelerator. So thank you for your attention. Shara, over to you.
Great. Thank you very much, Valérie and Mira, for giving us a presentation that I know is difficult to do, of 2 very rich papers in only 10 minutes. So the good thing is people have links that they can go to, and so therefore I'm very happy to now move on and kind of take from your paper perhaps 2 key lessons. The first being that there are diversity of options that countries have in terms of capacity and mechanisms for mobilizing resources. And secondly, that it matters not only how resources are spent, but also issues of equity and solidarity are key in how resources are mobilized, particularly in a context where we are grappling with increasingly growing inequalities of different kinds in countries, and the mobilization of resources in an equitable way is one way of trying to reduce those inequalities. So with that, let me turn now to our very distinguished panel. We have 3 panelists whom I will kind of introduce alphabetically, if I may. We have Marcus Manuel here, who's a senior research associate at the ODI in the United Kingdom. We have Catherine Ehlers, who's head of the Population Policy and Social Protection Division in the Federal Ministry for Economic Cooperation and Development in Germany. And we have Richard Rory, who's a social protection policy and research analyst from the National Social Security Fund based in Kenya. So welcome to all 3 of you to this panel. And if I can begin by posing a question to Richard, if I may. And we heard about Kenya in the presentation. And we know that over the past years, many countries have increased the kind of investment that they're making in social protection, including Kenya being one of the examples of countries that has done quite well in this regard. Now, in line with its national social protection policy, we have also seen that Kenya has committed to really allocating more resources to social protection, and also that it has managed to, at the same time, progressively reduce its reliance on resources from external partners, in a way showing that international financing, when it comes in, it can crowd in domestic resources, and therefore domestic resources can assume a bigger share. So that's kind of, I think, a very great scenario that one would like to see happening in many countries. So Richard, if we may sort of ask you to say a little bit more about the strategies that have been used to mobilize more domestic resources for social protection. If you could elaborate on that, I think that would be very helpful. Over to you.
Thank you, Zaira, and my fellow panelists, Marcus and Catherine. Thank you also to Mira and Valerie for a very, very good presentation. And like Sarah said, really, you can't do justice to such studies within only 10 minutes. Now, my name is Richard Rory from Kenya, and I want to start by commenting on what Sarah said. Indeed, in Kenya, social protection is not only a right, but it is an investment. Our Constitution 2010, Article 43, Article 1E, recognizes it as such. Again, I want to say at the onset that this particular webinar couldn't have come at a better time. Investing more and better in universal social protection, especially during this COVID-19 time, is really, it has, and we have noted this in very many recent reports and findings, that the pandemic has exposed inequalities, gaps in terms of coverage, gaps in terms of comprehensiveness, gaps in terms of adequacy across countries. And again, over and above that, you realize that right now the concern is really how do we sustain. It's not just enough introducing programs, but the sustainability of those programs. And just like in very many other countries, it's often argued that social protection is not affordable, but countries have been able to show that it is affordable. And indeed, that's why Myra and Valerie were making case for Kenya, that we have been able, currently, Kenya's cash transfer programs cover about 1.3 million Kenyans. And we are spending about 0.3% of our GDP. Our projection, according to our social protection investment plan, is that by 2030, Kenya should be able to spend about 2% of our GDP. We believe that going by the plan, we should be able to achieve that. Now, if you examine the situation globally, you know that, and this has been commented on by Valerie and Myra, you note that the use of various strategies, and that very many countries have got various strategies. She commented about Botswana, she commented about Zambia, which uses even our mines to support social protection. And again, a large number of countries are using taxes to fund that. Kenya, we use taxes. Actually, our social protection programs are fully funded by the government of the Republic of Kenya. Again, another thing that I want to say is that across look of those programs, you realize that we have invested the most in terms of the programs. And right now in Kenya, we have various programs that are universal, particularly the older person's cash transfer, where we are giving about $200 per month to the older persons that are 70 years and above. Now, one very, very important thing that I want to say is that when schemes are targeted at the poor, and this we note everywhere in the world, and especially even in Kenya, governments are much less willing because then they don't attract the support. Governments will be more willing to programs that are universal. As we are talking right now, Kenya is preparing for general elections come August, and social protection issues are popping up, and because they are attractive to the voters and the population, and in particular the taxpayers. Consequently, taxpayers are reluctant for taxes to be spent on schemes which do not benefit them. So in essence, when we are now talking about universality, we are talking to the taxpayers. They are looking at what is in it for me. That's what the taxpayer is looking at. And the programs that are universal are bound to attract more support, public support, than those that are not universal. If you look at the case of Mauritius, for instance, the school transport that covers all students right from basic education to university, that program is very, very attractive because it is universal. Now, Kenya has used several strategies to mobilize more domestic resources for social protection, and they include development of social protection policies, like we had the National Social Protection Policy 2011. We have just completed drafting the Kenya Social Protection Policy 2021. It is awaiting cabinet approval. We have also ensured that our social protection programs are anchored on policies and legislation. The idea here being, when it's anchored on policy, when it's anchored on legislation, then regardless of who comes to office, that program has legitimacy, and that's making them attractive. Again, universal schemes in Kenya are more popular, and as a result, our government is more willing to invest more. And that is why in 2017, the government right now in office came to office because it talked about universal cash transfer for all our persons. It was very attractive. Result, they got into office. We are now getting to 2022. We are looking at the presidential candidates. What are they giving? The voters are ready and willing to listen. The other thing I want to say is that in Kenya, for example, the scheme with the largest expenditure is our universal old age pension, which I've just talked about. And this particular scheme, you'll note that it was as a result of a campaign strategy by the government that is in office today. We are now looking at whether Kenya can introduce universal child benefit. It's actually being piloted. And now that we are getting into elections, we want to believe that the government that will get into office come August 2022, it will buy in this, and we expect a lot to be done. In conclusion, what I want to say is that I wish to state that each country is unique. Kenya is equally unique. And with that uniqueness, all the options that Myra and Valerie talked about are applicable depending on the country's nature. And it is important that for it to be done, there has to be appropriate legislation. Universality cannot succeed without appropriate legislation. The other thing is that there has to be advocacy and communication, because unless you create awareness, unless there is advocacy, then you may not be able to attract that public support. The other thing I want to say just before, Saira, I can see you really want to log me out, but just allow me to finish. There is also the issue of strengthening the systems, because without strengthening the systems, then that universality may not apply. But again, over and above everything, national dialogue is critical. National dialogue is critical. However, given the importance of public investments for human rights and inclusive development, it is important that governments explore all possible alternatives that Valerie and Myra talked about to expand physical space to promote universality in social protection. Thank you.
Thanks a lot, Richard. I didn't want to stop you because everything you said was really very valuable. I think this whole lesson from Kenya about the sort of the power of universality. In a way, I think what you described is about really creating a state society, a new kind of social contract, whereby, you know, people buy in to and are willing to pay the taxes because they see very wide benefits for them as well, rather than this kind of scenario of very narrowly targeted programs that reach very few and don't get the same kind of buy-in from everyone, which then makes them financially not very sustainable. So I think there's a very powerful lesson there about how to create universality. I think you also very importantly highlighted the importance of the legal anchoring, which is key, the good communication so that people understand and there is a lot of clarity about the intentions of what the government is doing and what the programs are, and there is greater awareness of rights. And I hope that later we can ask you a bit more about the details of that. But if I can just follow up very briefly, if you could maybe just take a couple of minutes and tell us a bit more about what role you see the international community can play in facilitating such a process, and any lessons you think that Kenya can bring for other countries. I think that we would love to hear that. And if you can just be brief on that, I would be very grateful. Thank you.
Thank you, Zaira. Allow me to state that all programs we have in Kenya, the orphans and vulnerable children program, the older persons program, the hunger and safety net program, all these programs began with collaboration between Kenya and our development partners, UNICEF, ILO, World Food Program. So all programs in the piloting, even right now, the Universal Child Benefit Program that we are talking about, the piloting that is going on is between the government of Kenya and UNICEF. And again, it is important that as we talk about it, it is critical that we find the funding for these programs. And sometimes it's not easy. It requires a lot of willingness. I need to state here very clearly that the success of social protection is a question of political willingness. The moment the government of the day is willing and wants to work with our development partners, it works very well. In Kenya, through the UNDAF framework, Kenya has achieved so much by working with our development partners, ILO, W Food Program, UNICEF, and even World Bank, DFID, all of them. And they contribute a lot in terms of even capacity building. And all these has contributed, particularly, and I need to say here that the support that Kenya has got has motivated the government and challenged the government. And you see, the development partners are concerned. And with that interest, the government of Kenya has put and invested because indeed they are seeing value for money.
Great.
Thank you,
Richard. And I think that provides a perfect segue, if I may now turn to Catherine and ask, really coming in from the development partners' point of view. I mean, we just heard from Richard about sort of Kenya's experience. And I think it would be really good to hear your sort of perspective, Catherine, as a donor, with regard to this question of really how can the international community support and complement, and in a way, if I can say, help crowd in the kind of domestic resource mobilization that is needed to make social protection a kind of nationally anchored and nationally sustainable endeavor, which is an ideal that I think we want to sort of see in many countries. Can you maybe share some examples of countries where you have seen this kind of role being played by the development partners? I think we would love to hear a few examples from you. So over to you.
Thank you very much, Shara, and good morning and good afternoon also from my side to everyone. I'm very happy to be here and to be able to join the panel. And thanks a lot also for the very interesting introduction and also for the figures and the very interesting example from Kenya. And I think this all shows there's really a gap in social protection. And I can say as German development cooperation, we are also very concerned about the increase in inequality, especially triggered by the COVID crisis. And also by the figures mentioned before, that more than half of the population doesn't have access to even one social protection benefit. So I think this is a situation we really have to cope with. And therefore, social protection is really one of the priorities also for German development cooperation, and became even more so now during the COVID crisis, as I think is the case for many other donors, and of course for national governments as well. If you look at all the social protection benefits that were introduced during the COVID crisis, but as we know, many of them are insufficient, are short-term, and are mainly in richer countries than in poorer countries. So there's really a large task to be done, I think, right now. As you asked for examples in German development cooperation, we committed additional funds now during the COVID crisis, about 500 million euro additionally to the programs we had already in existence. And the portfolio is quite widespread. For example, we have a large portfolio in the Sahel region, where we cooperate closely with World Food Programme, UNICEF, World Bank, other bilateral donors. And I think this is a very valuable effort to really have a close donor cooperation in close contact, in close cooperation with the partner governments. And we have also supported, for example, Cambodia, the social registry ID Poor program, which helps to identify poor and vulnerable households. And there are similar programs in Indonesia, for example, in Brasilia, Pakistan. We are supporting health systems, and these are all efforts on a long term that started before the COVID crisis. And maybe let me just mention some lessons learned from this engagement before COVID and during COVID. I think one very important point was where national systems were in place already, it was much easier to channel funds during the COVID crisis. For example, in Cambodia, where we had this long-standing cooperation, there could be really a quick and efficient response to additional needs during the pandemic, because the systems were in place, the registries were there, digital data was there, and you knew how to really target the poor and vulnerable households. And I think this really shows that system building is at the very center. And as was mentioned before, this is something that the partner government really needs to be in the driver's seat. International donors can come in and complement, but this is very much in the responsibility of the partner countries. Another experience is that it's really, there's, I think, too little policy coherence and cooperation between donors. This was mentioned before already. It's important to have a whole of government approach on the partner country side, and then have the donors come in a really coordinated manner. And I think one instrument which is really helpful to achieve this is policy-based lending, because then you really have a national agenda. You discuss between partner country and donor partners the steps that are implemented, and you come in with funding directly to the state budget. So you can really secure that you're not working only with the line ministry, but Ministry of Finance is involved, and the whole issue of finance mobilization, etc., is addressed in policy lending. So I think this is a very good instrument, which we start now in Rwanda as well, together with other partners. And of course, what is important as well is technical cooperation in addition. I think investments should be complemented by technical cooperation, especially when you look at long-term systems building. This is very important. And I think for German development cooperation, one of the challenges we face now is coming from the COVID-19 support, which has been an emergency support, cash transfers in many cases, is how to integrate this into long-term systems and also into preparedness for possible further crises, climate crisis, pandemics, etc. And therefore, I think it's quite important not only to address individual risks, but also collective risks, like risk which go along with climate change, etc. And this is, I think, one of the things that the international community, IFIs, partner countries, donor countries should address in the future even more than now. But I will stop here. Thanks a lot, Shara.
Thank you very much, Catherine. I think you raised some really important points, not only about governments needing to have a whole of government approach and really aligning the different ministries, but also greater coherence among donors to be able to work effectively with partner countries in, as you said, building systems, because unfortunately what we do know is that this is not going to be the only crisis that we're going to see in our lifetimes. And the climate crisis is really a looming one for which we need to be much more prepared. So with that, let me just now, if I may, turn to Marcus. And Marcus, you are a development economist with more than 30 years of experience in the area of international development. So you come in with a lot of lessons learned from that engagement. Now, from your point of view, it would be really good to know how you think governments and social partners and development partners as well could ensure that additional resources, whatever their source, whether it's domestically mobilized or internationally, how we can ensure that these resources are really systematically used to build universal social protection systems and that can provide really adequate social protection for all. How do we ensure that this kind of mobilization is channeled into the building of universal systems? I think we would really like to hear your reflections on that.
Sarah, thank you very much for that introduction. I'm reminded there's a bad joke about economists. You put a whole lot of people on an island, they're shipwrecked, and all they have is a lot of tinned food. So the group turns to the economist and said, well, what will you do about this? So the economist says, imagine we had a tin opener. Yeah, we economists are fond of saying, well, if we had all the resources, then this is what we could do. And I think my main message, I think, for today is I think we need to be realistic. I think we have a wonderful set of papers that have been put out by the ILO, and I think it is both about investing more and about investing better. And I would commend to everyone to read these papers. I think they're superb in terms of outlining the agendas that are involved and the scale of challenges that's involved in trying to tackle this. What I think, though, if we're going to make progress, we do need to be more realistic about the challenges that we have. And I wonder if we could just have a slide coming up at this point that I'd, from the Secretariat. Oh, thank you very much indeed. So what we're trying to do here is really build on that really useful chart in the Invest More paper, which talks about, how quickly can governments start to afford to pay for this themselves? And the answer, I think, in countries like Kenya is, quite quickly, maybe 10 years is feasible. But there are many countries that can't, and this is where I want to focus, partly to lift it to give a different country to Kenya, but partly also to, when we think about the people most at risk of being left behind, as the ILO papers remind us, it's mainly in low-income countries. So what we've done here is try and work out what level of domestic finance can be raised by low-income countries, and going at a very granular level, country by country. And we've looked about what they can do to maximize taxes. There's not a lot of room on the macro side. COVID has removed almost all room there was for increasing debt or doing other sides. So we've just looked at what the ability to increase taxes are by about 2030. So, I mean, taking a slightly longer term perspective. We've also then said, well, how much of budgets could low-income countries afford, or any country can afford, to put to social protection? Not as a proportion of GDP, but as a portion of their budgets. Now, in OECD countries, it's up to nearly 30% in some countries. So you just say, well, okay, let's just assume a half. Let's assume 14, 15% is what's sort of achievable. What would be this would be a reasonable amount to expect. Now, even if we take those optimistic assumptions, two things fall out. First of all, the encouraging news: most middle-income countries can afford to do this in a 7-year horizon. Most of them can afford to fund universal social protection for a basic set of floors. And that's really encouraging to note. But there are some countries which can't. And these are the countries where the lack of finance is going to be particularly constraining. And what I've put in here is an illustration of the countries and what proportion we think they could afford in that sort of medium-term framework to reach. And some like Malawi are way less than half, some like Rwanda is a bit better. Now in this chart, I've also added the existing allocations of aid. And you have to really strain your eyes to see it because it's a pretty small amount in every country. On average, the gap is something like $34 per person. And on average, aid is something like $1 per person. And it's pretty, it's spread pretty thinly as well. So you can see at the moment what we're currently doing on the aid side is really much lower than much lower than is needed. And I think that's important because that needs to shape being real. How fast can we introduce social protection? What sort of priorities have to be taken? Because if we're going to get the international funding and the domestic funding working well hand in hand, the starting point is everyone being realistic about what's achievable and what's affordable from domestic finance. So we can't just say, donors can't keep saying it's basically all your responsibility to do this. I think we need to be quite real about it. And I say this kind of research, we hope will try and sort of push that agenda forward. But it just gives an idea of the gap. And the gap still comes out at something like 27 billion a year, even if you on the kind of basis. So we're still talking very large sums of money. And while the Global Accelerator is a great device, and I think potentially could be a really useful step forward, obviously the funding ambition under that is something like 1% of that total. So we have a whole way to go if we're going to think further about how we can resource these issues. I hope later on, if I have a chance to answer a second question, I can pick up more about, okay, what might happen on the donor side. But I think the starting point, this is about country ownership and therefore knowing what countries can afford to do and what's realistic for them to be able to afford to do, I think is really important if all sides are going to work out how we step forward together. Thank you.
Thank you. Before I leave you for now, Marcus, can you just explain what you mean by the 4, the number 4 before the SP, the 4 guarantees? It may not be clear to all our readers.
Thank you. So what I've done in that chart is I've excluded health on the basis that health is quite well funded, much better funded than social protection, as the ILO papers do. So I've set that to one side. So I'm then talking about the other 4 floors that are talked about in the ILO paper. So children, elderly, people living with disability, and maternity grants. So that basic set of 4 grants. Thank you for the question.
Okay, great. I think that's much clearer. Thank you very much for that. And if I can now turn over again to Richard and just ask you, we just heard from Marcus, but really we want to know what is your experience in Kenya in this regard? How do you ensure, and this is a really important question, when the resources for social protection are being raised not through the contributory system, but it's coming through taxation, on which there are many, or I should say general revenue. I mean, taxation can be a big part of it, but general government revenue. When there are many claims on those resources, how do you ensure that the additional resources that are raised are actually being used systematically towards using it for social protection and achieving universal social protection for all? There must be a lot of competition for these, domestic general revenues that are raised. So can you elaborate a bit on that?
Thank you so much. And thank you, Marcus, for your very good presentation. Indeed, there are priorities and competing priorities. And we did see this one during the COVID-19 pandemic, when people are losing jobs, there was joblessness. Really, and again, poverty, like we normally say, is multidimensional. And so you're looking at the funds that you have and how best they can be used. I think one very important thing that needs to be considered is that we need to use an integrated approach. If you saw the last slide of Myra and Valerie, the first pillar is about integration. And this is very, very important in terms of that the relationship between, for instance, and Marcus brought it up when he was talking about the 4. But again, you can look at even agriculture and education, which are essentially social protection issues. But he focused more on the 4, persons with disability, older persons, etc. And if you look at all these groups are the most vulnerable. And so the most important thing is how do we, because you have several agencies, several institutions coming in, and you find at the end of the day that there is duplication. But if we create coherency, then we work together towards those priorities. And we put the resources together and work together with the national government. Like in Kenya, we have got the county government and we have the national government. So you'll find that because social protection is a national government function, but you will find the county governments coming up with their own programs. But if the county government and the national government together and they create that coherency, then it can work. You look at, for instance, the issue of graduation and exit from programs. Because when you find institutions working and each introducing, then you find, actually, for lack of a better word, you find funds being wasted when they could have been better used if we created coherence of this. And in my view, we can look at more innovative sources of financing, and we can work. Recently, IMF has proposed several channels that can be used. But what of importance is how best can the various players come together, talk together, identify the priorities, look at the funds available, and see how best they can be utilized. Thank you. I need to say something before I log up. I say that Kenya gives $200 a month. No, it is $20 a month. That was a slip of the tongue.
Yeah, thank you very much for that, Richard. We already had a comment in the comment box. We had a.
I realized and I said, wow.
Okay, thank you for that clarification nonetheless for our colleagues who may not have been following the chat. So I think that was very helpful. And if I can now maybe turn again to Catherine and to sort of one more question for you here. In the past, we've seen that, progress has been made towards achieving universal social protection when it has been possible to have consensus across different institutions, whether we're talking about at the national level or in the global system. And the problem often is that we have this kind of disconnect between the institutions that are in charge of public finance management, let's say, at the national level, and those that are responsible for the design and implementation of social protection systems. And we see this in a way replicated, at the global level as well. Well, there is a bit of incoherence between, the global kind of, or UN agencies in charge of, or having a strong mandate for social protection, and those who have their kind of mandate more in the realm of macroeconomic policies and financing priorities and fiscal policies. So, this disconnect kind of makes it very difficult. Can you say a little bit more about how one can overcome that kind of lack of consensus, and really build a much better way of having these different institutions work together, whether you want to take the example from the national level or at the global level? We would really appreciate having your reflections on that, Catherine.
Yeah, thank you, Shara. And I think this is really a really great challenge because as was mentioned earlier, we already know a lot about what has to be done. I think Mira mentioned before the 19 principles that should be put in place, and we already then have kind of a framework to really assist social protection in a sustainable manner. And we have, for example, the Paris Declaration on Aid Effectiveness. I think this is also very important to improve coordination and coherence between the international community and the donor community. And yeah, so I think a lot is known already, but it's not really implemented. And this is a challenge since many years. And this shows already it's not easy. I think, yeah, one of the points is, in my view, that social protection is really kind of an overarching issue. It has interlinkages to many other sectoral issues like health, like education, like nutrition. I think targets in these sectors can only be achieved when you have really sustainable social protection systems. And I feel sometimes this is not really addressed and not really seen. Social protection is dealt with line ministries in a kind of, yeah, very not overarching enough way. And this kind of hinders, I think, the implementation of really good and well-financed social protection systems. And so I'm really quite optimistic about the proposal for the global accelerator, because I think this brings new momentum into the international discussion. This could be something where donors can align to, where partner countries will be in the lead, which is very important. And I really hope, and I can say for the German side, that we are ready to cooperate with you in the implementation strategy. So I really hope this brings kind of a new momentum. And then I think it's important, you know, just to address the principles and the guidelines that have been developed already, and just try to implement them, and to do this with countries who are willing to do this, like Richard was reporting from Kenya, who are really prioritizing social protection in their agenda. And yeah, then I really hope we can make some progress during the next years. Thanks a lot, Shara.
Thank you, Catherine. And if I can just go back to Richard very briefly and ask, you know, at the national level, you know, what would you say, or how were you able to really create that kind of connection between, let's say, ministries of finance, planning, and then the social ministries, social security agencies? How were you able to bring them together and really have this kind of coherence play out at the national level? I think it would be good if you could briefly just give us a glimpse into the dynamics that you were able to create.
Thank you so much, Zara, for that. Now, one thing that I did say right at the beginning is that in Kenya, we are guided by policies. We have got Kenya Vision 2030. We have the Kenya National Social Protection Policy, and we have got the National Social Protection Secretariat. Now, the Secretariat coordinates these, and all players are in social protection. And again, even the way we report to the UN under UNDAP, all the social protection ministries, line ministries that have got an aspect to deal with the social protection, we meet, and we normally have monthly meetings where we compare notes, and we have a work plan, and we look through on how we are doing. But again, of importance, and probably for this, and like you have asked, is really the government, because we work for the government, and the leadership of Kenya at the moment is championing social protection matters. In Kenya, the government has the big four being health, shelter, nutrition, and of course, the issue of job creation. Now, if you look at those, then you realize that very many ministries come together and are looking at what is being done. But again, I need to say, and I need to add probably very quickly, that once you have a legislation system and a very clear M&E and a research framework, together with the accountability and a clear fund, you know, the clear feasibility, and like I said earlier, communication, then you can be guaranteed of a fiscal space. Because as noted, and as my colleagues have just said, national governments, and including the Kenya government, we prefer to get behind programs that attract public support. And even right now, as we are working on the universal child benefit, most importantly, the ministries that are involved, because when we are designing the programs, we involve the line ministries, because then then we get that support. And once we get that support, together with cabinet approval, it becomes very, very easy then to go to Treasury and get the funding that is required. And it's because of that that even the older person's cash transfer, we were able to get that because of that support. Now, in regard to what you have also said, if we work together with one determined goal, with the support of the government, then the taxpayers will support. We're looking forward because we're just watching what is happening with our presidential candidates, and they're giving a lot of support. If that comes to pass come August, Kenya is going to shine.
Great, thank you so much, and great to see that social protection can be an electoral issue, and that's great in terms of how one builds a kind of rights-based system with the laws and the accountability frameworks. Thank you for highlighting, I think, those really important issues that are sometimes left out of, these discussions around financing, which can become a little bit economistic and not sufficiently kind of bring in the political economy dimension. So talking of economists, I'm going to turn back to Marcus, if I may. I think you said that you do want to maybe have another chance at saying what donors can do. And I'm really thinking more in terms of what, not so much in their capacity as donors, but also in their capacity as powerful countries that shape the global financial architecture. I think another discussion that has gained considerable momentum in recent years is how we can create this kind of overall environment that is conducive, a sort of enabling environment that can help countries increase their fiscal space at the domestic level. And so could you elaborate a bit more on this, and how can countries and the international community create this kind of enabling environment that will help less powerful countries, developing countries, low-income countries, the ones that you had in your chart, be able to do more effective domestic resource mobilization? I mean, I think I would be really interested in particular in your views on the kind of this global financial architecture that we have now, which often kind of leads to, countries bleeding out their resources, whether it's because of tax loopholes and safe havens and countries losing, millions and billions to that, or whether it's because of onerous debt payments they have to make, or draconian conditionalities on multilateral financial assistance. So how can we really try and create a global financial architecture that is not so disabling, and in fact that can be more enabling and help countries mobilize resources domestically? I think your reflections on that would be great to have, Marcus. Over to you.
Thank you very much. And if I could have my next slide, I just want to start with a piece of good news, because which is just coming out of some research. This is the figures of how much aid has been going to social protection. So aid, as we know, includes concessional lending by banks. And this is just a very narrow definition of aid. It doesn't capture everything. It doesn't capture food security or budget support. So it's not capturing everything, but it's a consistent time series. What you can see from here was back in the 2005, there was very little aid. I mean, less than $1 billion was coming. That jumped in 2008 when various large-scale programs were started in various countries. Those then died away. But what we've seen in the last 2 years during COVID is a massive jump up. And what's really encouraging to me on the numbers that we're looking at is not only did that increase in 2020 as people responded to COVID, it's actually accelerated further in 2021. And this is now lifting us from levels of 2 to close to 5, and its potential, this could easily rise to 6 billion in the future. This is quite game-changing sums of money. To give you one idea, the fiscal gap to reduce universal child benefit in all low-income countries for children aged just between 0 and 3, so let's take something really minimal, is $5 billion a year. That's sort of affordable within the kind of numbers that we're now seeing in aid. So if you like, one of the real challenges is how do we ensure this dramatic change in aid, it's not enough, but it's an important change. How does that get stuck? And more importantly, how does that get spent well? And I think to come to your bigger question, Sarah, you asked about, well, okay, what do we need to do about the financial architecture? And here I do genuinely think there are lessons to be learned from the Global Fund for AIDS, tuberculosis and malaria, which interestingly disperses about $4 billion a year. So it's this kind of level, even for its size. Because I think what that global fund has done has changed the dynamic of country ownership. Rather than countries relying on whichever donors happen to be in their country coming together and reaching some agreement, they're asked on a consistent basis across the world to produce their plan for how they want to do the next stage of social protection or on health. And then their plan is subjected to review, not just by the World Bank Board or by individual donor agencies, but by a global community, including in particular its peers, other low-income countries. Also civil society has a chance to engage, and you get a much broader process which allows what I think is the fundamental starting place, the country ownership. I think the other thing the Global Fund has done, apart from raising money and changing country ownership, is it has raised the political attention on it, and you bring in it a much greater international attention and also domestic attention, which I think is incredibly important if we're going to try and sustain what we're trying to do. And I think you need something quite high level like this, something that's also quite focused about, well, what happens if we don't provide money, to really help motivate people. Because there's been 20 or 30 years that we tried to change the global financial architecture. And there's been no shortage of ideas, and I've been involved in some of them for 20 or 30 years. But we need to be realistic about what we've managed to achieve. Debt relief was a key thing 20 years ago, but it hasn't proved to be additional resources. It's part of ODA. And ODA, as a portion of gross national income, hasn't changed for the last 20 years. And similarly, climate finance was supposed to be 100 billion, was supposed to be an additional amount of resources flowing in. It's proved not to be additional, and people are struggling to meet the target. So I think we need to be realistic, I suppose, about what we can achieve. I would love to be able to achieve the agenda. I think using SDRs and making sure SDRs are spent well is a key part of what we're trying to do. But I also think that just trying to change it from one sector alone, we need to find allies who are going to work with us on this to try and achieve that. So I think, my answer would be, not only do we need to increase the ODA, not only do we need to think about the international architecture for social protection, but we also need to think about how we think about the high level global architecture. For example, the corporation tax has been set at a new minimum, but is anyone proposing that some of that is allocated to poorer countries? That's not unfortunately happening. So I think we need to be realistic about the challenges, and therefore we need to scale what we do in response to that. Thank you.
Okay, great. Thank you very much, Marcus. And I am conscious of time. We are almost out of time. And I did see that Richard would like to respond to a comment that was posed about the role of CSOs. So please come in, Richard, and then I think we may unfortunately need to wrap up.
Thank you, Zara, that you were able to note that. Indeed, a question was asked, the role of the civil society. I want to state here that the civil society is very, very critical in the development and the expansion of social protection, and particularly in Kenya. We have got a very vibrant social protection community, and in whatever program that we have participated in, if you don't involve them, they'll go to the Kenya National Human Rights and their voice will be heard. And because of that, and our constitution demands that there is public participation. And through them now, the Kenya Social Protection Platform, together with the African Platform for Social Protection, they have played a very key role, and together also with so many other NGOs, and through that, the voice of the unheard is heard. Thank you.
Thank you very much, Richard, for your observations about the very enabling role that civil society organizations can play. And I must say, from an ILO perspective, we feel that our social partners can also be an important part of that kind of social dialogue and conversation about rights and how those can be realized. So if I can now just, first of all, thank you all for being here in this space. You have seen the links to the papers as well as to other resources that were shared. I think if we can just maybe pick up a few ideas that have come, and many interesting ideas were suggested by the papers, by the panelists. But I do want to emphasize, the point about the fact that increasing fiscal space for social protection is a possibility. We have evidence that it works. Not only in some countries, and today we heard a lot about Kenya, but also in a wider range of countries. Many options exist, even in these difficult times. And I think I do want to emphasize that the ILO, through its flagship program on building social protection force for all, will be supporting the ILO member states in implementing many of the ideas that were in the papers that were discussed today about increasing fiscal space for social protection, about ensuring that additional financial support not only complements national resources, but also really supports countries in building national domestic resource mobilization strategies and capacities. That is absolutely key, that it does that. And about the importance of, which was raised again in the panel, about the importance of linking financial assistance with technical support and technical assistance, and making sure that national social protection systems are aligned with international human rights and international social security standards, about maximizing the available resources for social protection. And I think very importantly, having the legal systems, the accountability mechanisms, the role of civil society and social partners in making sure that states are accountable and that right holders can have the sort of realization of their rights. And that these discussions around financing are really made kind of clear, are not obfuscated, and are made clear about the important decisions that have to be made about how to mobilize resources, how the burden sharing is to be done, how it can be more equitable and really be premised on solidarity. And then, of course, decisions about how resources are allocated to social protection, and within the social protection envelope, how we do that. And we heard a lot about the power of universalism in really being able to not only create universal social protection systems that benefit all, but also to really create the kind of traction that is needed for people to pay into the system because they see benefits from the system. So you have a greater number of people who are willing to pay taxes because the system also benefits them, rather than a much narrower set of so-called the poorest of the poor. So the beauty of universalism also in terms of increasing the financing of social protection. Many more wisdom in the presentations and in the papers and through the links that were provided. Thank you all for your time. And I think we're only 2 minutes above our time limit. So let me just thank all our panelists, my colleagues, Valerie and Mira, and socialprotection.org for helping us come together in this discussion. Thank you and have a good rest of day, evening, and see you soon.